Have you ever noticed a distinct whistling or squeaking sound when someone breathes, or perhaps even experienced it yourself? This sound, known as wheezing, is a clear signal that something is making it harder for air to move freely through the lungs. It is a common and often concerning symptom, especially for those living with chronic lung conditions. Chronic Obstructive Pulmonary Disease, or COPD, causes airways to narrow and produce wheezing through a combination of chronic inflammation, excessive mucus production, and a loss of the natural elasticity within the lungs. These factors work together to obstruct the flow of air, particularly when you breathe out, leading to the high-pitched sounds you hear. The primary mechanisms involve persistent irritation and inflammation within the bronchial tubes. Over time, this inflammation causes the walls of your airways to thicken and swell. Simultaneously, the glands in your lungs begin to overproduce thick, sticky mucus, which further clogs these already narrowed passages. In the case of emphysema, which is one form of COPD, the tiny air sacs, or alveoli, at the end of the airways are damaged, leading to a loss of elastic recoil. This means the airways struggle to stay open during exhalation, effectively collapsing and trapping air inside. When air is forced through these constricted, mucus-filled, or collapsing tubes, it creates a turbulent flow, much like air passing through a whistle, which is what we perceive as wheezing. Understanding this process helps you recognize why wheezing occurs and appreciate the importance of your COPD management plan. It highlights that treatments are designed to counteract these specific issues, such as reducing inflammation, clearing mucus, and helping to keep your airways as open as possible. Recognizing wheezing as a sign of airway obstruction can prompt you to take necessary actions, like using a rescue inhaler as prescribed by your doctor. An interesting aspect of this narrowing is something called dynamic airway compression, which is particularly evident during exhalation in COPD because the damaged lungs lose their ability to support the airways. The increased pressure during a forced exhale can actually cause the airways to collapse even further. This makes it exceptionally difficult for air to escape, intensifying the wheezing sound and trapping more air in the lungs. By understanding how COPD physically narrows your airways and leads to wheezing, you gain valuable insight into your condition. This knowledge empowers you to better manage your symptoms, adhere to your treatment strategies, and work more effectively with your healthcare team to improve your breathing and overall quality of life.